Hello, everyone. Thank you so much for joining us this afternoon. My name is Barb Netterpel, and I am the president of the Hospital Employees Union. My pronouns are she and her. And I'm very proud to be hosting this webinar this afternoon from the traditional, ancestral, and the unceded territories of the Coast Salish people, including lands belonging to the Squamish, Musqueam, and Tsleil-Waututh nations. As we heard in our first webinar on the issue of missing and murdered Indigenous women and girls, we know that the plight of women cannot be separated from the history of colonization and the residential school system, which took many Indigenous children away from their families and their mothers. Becoming aware of this history and our own relationship with the land that we are living on is one very small step towards reconciliation. To learn about the traditional territories that you are on, you may visit native-land.ca. And please feel free to share in the chat which territories you're zooming in from today. It's especially important to be reflecting on this as we are on the evening before September 30th, which is Orange Shirt Day. Now, we all know that this pandemic has had a massive effect on our society, and we are seeing that women have been disproportionately affected. And I'm very pleased to be introducing this webinar on the unique impact that COVID-19 has had on women. So I want to say thank you to everyone that is on the Women's Committee. If you're here and you're watching, please feel free to introduce yourselves in the chat so that we can celebrate the work that you've been doing. So I have to say that the Women's Committee at HEU has been a force to champion women's equity in our union and in the labor movement and in our community since the founding of the committee in 2018. We're so grateful to all of the efforts of the current committee to fight for an intersectional feminist vision for HEU women. So again, thank you to the Women's Committee at HEU for all of your work. And we are ready to celebrate you. And we are going to be talking this evening in this webinar on the unique impact of COVID-19. Because again, we know that this pandemic has had massive effects on our society, and we're seeing that women have been disproportionately affected. And HEU's membership is largely made up of women. And, they've not just been working in an essential service, but literally on the front lines of this pandemic. And it has taken a huge toll on our members. So to help us dive into this topic, we have invited two very, very special guests. First, we have the president and CEO of the BC Women's Health Foundation, Genesa M. Greening. And Genesa collaborates with those who share her commitment to gender equity in healthcare and invests in charitable causes that deliver social change. She has received the honor of being selected by the Business in Vancouver as its Influential Women in Business Award winner and is a repeat Women's Executive Network Top 100 Most Powerful Women in Canada awarded recipient. And Genesa was also selected by the Governing Council of the Canadian Institute of Health Research to join their advisory board with the Institute of Gender and Health. Genesa has served as a member of the Prime Minister's Women's Delivery National Council and is also a member of the World Health Organization's Working Group on Advocacy and Communications for the Cervical Cancer Elimination Initiative. And I'm really proud that Genesa and her team has collaborated with HEU on studying the impact of COVID on women healthcare workers, which is exactly why we're here to talk about tonight. So welcome, Genesa.
Hello, thanks for having me. I'm excited to be here.
I'm also very pleased to be welcoming a community organizer and local activist, and of course, a new Westminster City Councillor, Nadine Nakagawa. She's also on our panel this afternoon, and Nadine has dedicated her focus on issues relating to housing, public spaces, reconciliation, public engagement, and childcare, and is the chair of the Reconciliation and Social Inclusion and Engagement Task Force, and is the chair of the Environment and Climate Advisory Committee. For her strong work in her community, Nadine was named the 2017 Citizen of the Year at the Chamber of Commerce Platinum Awards. She works in the nonprofit sector and has a master's degree in interdisciplinary studies. Welcome, Nadine.
Thank you. It's nice to be here.
Well, today we're going to be talking to these fierce and fantastic feminists, about just a series of questions around COVID-19 and the disproportionate impact on women. So for those of you who are watching live right now, if you have any questions at all during the webinar, if you want to put them into the chat, we'll see if we can integrate them into our conversation. But definitely at the end, we aim to have about 10 to 15 minutes to address some of those questions from members and our viewers. So if you're ready, my friends, I think we should just dive right in. So tell us, let's start with you, Nadine. Tell us about what you think is the unique impact that COVID-19 has had on women.
Well, I mean, this is such a big question in general because women are not all one thing, of course. We are many different people have different experiences and different lives. But what we know is that women are often frontline workers. So they're very heavily represented in healthcare. So I've been on the front line of the COVID pandemic, but also work in a lot of low-wage jobs like service industry jobs. And we know that often they are caregivers for family and for friends. And so that means that not only have they been really impacted by having to be, I think, frightened by working directly with people who have COVID or being exposed to COVID. We know that the difficulties of caring for people in our communities has been made more difficult, that a lot of these caregiving networks have been broken down, and the ways that we would normally show up for each other are interrupted. So it's been an additional burden. And we do know, I remember the conversation, it feels very important to say that right when the pandemic first hit, automatically we saw increases in domestic violence and violence against women. And I have no doubt that that is still the case, although we're not hearing the conversations as much. In fact, I think as people are even more isolated and even more tired of living so isolated from communities, I'm sure those numbers, in fact, have increased.
I'm sure they have. And it's interesting that we don't have the data on that just yet. Genesa, I'm going to put the same question to you. What do you think has been the unique impact of COVID-19 on women?
I think Nadine's touched on a lot of the pieces. I think, the reality, I often use the expression that women are the sinew of culture. We kind of hold so much of things together. And, Nadine rightfully pointed out, I mean, the 4 top jobs that women hold in this province are healthcare workers, retail, and hospitality and education, I believe is the 4th one. And so if you think about those 4 roles, and the fact that women actually, interestingly enough, don't just actually predominantly are employed in those sectors. They also tend to be the ones who are not in management, who are not in leadership roles, which did put them at greater risk of exposure. It also put them at greater risk of precarious employment. So we also saw a lot of job losses for women at the beginning of the pandemic and then interrupted employment throughout the pandemic, right? The shutdowns, the public health orders, and how that impacted some of those sectors. There's also that intersectionality of how so many of the women that are healthcare workers are also folks taking transit, who have trouble finding childcare, who are also caregivers in their own families, as Nadine also mentioned. Long-term care for us as a foundation has been an interesting reflection for us, because it really is kind of a microcosm of gender, in the sense that you think about the fact that the majority of patients in long-term care are women, the majority of healthcare workers are women, and we've seen a great disparity in wage in that sector. And the majority of family members who actually have historically gone in and provided supports to patients in long-term care are also women. Mm-hmm. And so, and that was the majority of the outbreaks and loss of life happened in long-term care facilities in this country. And so there's so much kind of at play when you talk about gender and you talk about the pandemic. And to just add to what Nadine said, we have seen just an atrocious increase in gender-based violence. And we definitely saw a lot more discussion around that at the beginning. I think that, the other thing that we haven't talked enough about is that there's also a lot of women experiencing gender-based violence who have children in the home, and the stress and strain that has put on them as mothers during this time. And so there's just been just compounding factors in every direction. And, if you start to look at, 80%, 70% of people who live in poverty in this country, actually it's 80% of people who live in poverty in this country are women and girls. So you start to think about how all of these things kind of intersect, and you start to really understand how the pandemic has, I think, left bare a lot of social constructs that we really need to spend some time addressing and looking at differently.
Yeah, absolutely. Nadine, do you think, is there any particular social programs that could have done better for women through the pandemic? Oh, you're on mute.
Yeah, all of them, maybe I would be the answer. We saw organizations like Battered Women Support Services just completely overwhelmed by the number of calls that they received. So clearly we should have beefed up funding to those organizations more so. But I think it revealed that there's so many things. So I used to work in organizing around healthcare, and these issues in long-term care, in all seniors care, for example, were known. HEU has been advocating about these for 2 decades now, at least, and probably before that. And I think it really revealed the inadequacy of all the programs that we have. So knowing that those workers there have been privatized, and that the wages and benefits have been rolled back, and seniority have been rolled back, and that's not good for the patients in long-term care as well. We know that housing is completely inadequate, and that women stay in abusive relationships because the housing rates, especially where I live in Metro Vancouver, but throughout the province, are completely out of reach. That if you need to leave, where do you go? And shelters are just a stopgap measure. We know that disability income assistance rates are embarrassingly low. They are far below poverty rates. And the CERB, while that benefited a lot of people on disability were given short-term top-ups and were not actually given the same rates. If we say that $2,000 a month is the minimum that people need to live, then why do people on disability assistance and income assistance receive far lower than that? So, and there's so many things. The funding around transit, that was something I got involved in early in the pandemic, is that they started to consider cutting transit routes. And we know that a lot of folks have been pushed further out, especially people who have shift work, precarious work. We're going to be impacted by that. We need better sources of funding for transit. It shouldn't be paid by user pay. It needs to be funded through core funding so we can get it to who most needs it. So I think it really just, when we first had the pandemic, we started talking about it as a great equalizer. And it's not a great equalizer. It's a great revealer. And it just showed that so many of us have been yelling and screaming about these programs. And I think the rest of our communities really saw what we are talking about. But yet, I'm not sure that we're actually working on addressing any of those key issues. We really went for stopgap measures rather than saying, hey, income assistance and disability, EI, these programs are all broken. Let's actually just make them dignified. Let's make them livable. We instead went, let's just plug the hole with CERB. Let's just not allow workers to move around from different care homes, rather than saying, and I mean, the government just took some cleaners in-house. So that was a really good move that I hope was spurred on by the pandemic and the learnings from that. But I think we just realized that all of our programs and services are completely inadequate, not to mention mental health. I mean, we don't essentially have a public mental health system, and we are going to need it. We need it, we needed it, and we really need it now. So I think truly everything that I can think about, it just has showed the inadequacy in how it serves the most marginalized and vulnerable in our communities.
Absolutely. And when it comes to healthcare, we know that after the SARS epidemic, that PTSD was a very long, drawn out recovery process for healthcare workers. So we anticipate that PTSD for this pandemic is going to be extreme. Further to that, Genesa, what do you think are some of the biggest challenges and opportunities?
Again, these questions are so big. So, I want to try and do them justice, but, to just kind of add to what Nadine was saying, and I've noticed a couple of comments in the chat too around kind of the focus and the health healthcare worker side, when it comes to what we're actually seeing in media and what people are talking about, predominantly are healthcare workers like doctors, nurses, and we have to do a much better job of talking about who actually allows the healthcare system to function every day, which, yes, of course, include doctors and nurses, but also include the lion's share of HEU membership, which, I'd love to share some kind of preliminary information, Barb, at some point during this conversation around what we've learned in our partnership with HEU. But I think the other thing we have to recognize is something that happened during the pandemic that I'm super curious to know what's going to happen in the long term. And we've actually commissioned a report on this, and I'm waiting to see what it reveals. But at the beginning of the pandemic, there had been some initial conversation around how we could see up to 30% of the nonprofit sector disappear, that they wouldn't be able to stay functioning. They wouldn't be able to keep their doors open. And, I don't know that those numbers are going to hold true because of the fact that the government did actually extend a lot of the supports to the nonprofit sector as well. But there's a greater conversation to be had, right? It's around, first of all, the nonprofit sector predominantly employs women, and predominant beneficiaries are women in the nonprofit sector. And if we saw the contraction there, the safety net for the safety net actually starts to fall apart. And you start to then see how so many of these resources and services that held us together by duct tape and string over this last year and a half are going to actually start to fall apart, the same way that we're seeing the stresses and strains on the healthcare system, and healthcare workers are going to have some of those longitudinal impacts on people's mental health, their ability to continue to work and live in these sectors. And that is very concerning, right? Nadine, you talked about BWSS, or Battered Women Support Services, EVA BC, same thing. Like, these organizations have done such incredible work with such little resources for such an extended period of time. It's not sustainable, and it's not gonna be what we need in order to recover from this. And I find that word in some ways underwhelming. I don't really want to recover. I kind of like to see us actually come out of this having learned something and actually aiming for something bigger than what we had before. And Nadine mentioned a lot of really great policy concepts on that. But I think that the piece that I think is the opportunity, and I see someone else in the comments also bring this up. We have a lot of healthcare workers that have had a very trying 18 months that don't get talked about, that don't get focused on, whether it's cleaning staff, whether it's staff that are working in the cafeteria, whether it's folks working that are often unseen by the system, and often by people who, when they think of healthcare, and I think it's a shame that we haven't had a bigger conversation about that. And I know, Barb, we've been working with HEU to really take a look at that. But some of the initial findings that we found, the real disparities are, there's that increased risk of infection and the stigma and marginalization that comes from that. There's been a huge lack of control for a lot of healthcare workers around their working environment. There was disproportionate considerations of some of that top-up pay that took place. There was inadequate social safety nets put in place for a lot of healthcare workers. And there's a lot that I hope that HEU and others can continue to have public and necessary conversations around, so that when we come to the end of this, we're not just dealing with the exhaustion, the potential PTSD, the mental health concerns, the lack of, retention, the increased attrition rates in the sector, and how that's good, but also just why that happened and how we can actually prevent it from happening in the future by valuing people, paying people what they deserve, making sure that we're actually taking people's input and considerations into how these systems work in the long term.
Absolutely. So what do you think also then, Genesa, about in your experience and through and by all means, feel free to talk about the work that we've been doing together on healthcare workers, because it really was important that that we look at all sectors of healthcare, every single worker in the system. So I'm really looking forward to that report coming out someday soon. So feel free to talk about it. That's fine. But what do you think are some of the common misconceptions that came up during, through COVID about the plight of women during the pandemic?
I think there's again such brilliant questions that I wish we could spend so much more time unpacking, and I'm hoping Nadine can build a little bit on this based on some of the stuff that she talked about earlier. But first of all, we're not homogenous, right? Women and gender diverse people have lived very different life experiences, and we've been talking a lot more about gender equity, I believe, since the start of the pandemic than we have for a while. And I think it also is beneficial that that's been part of the social dialogue and trajectory over the last few years. So it was well timed. But there's so much more to it, right? I think that we haven't been talking enough about race and gender. We haven't been talking enough about age and gender. We haven't been talking enough about socioeconomic status and gender. And we've been talking a lot about moms, and I am one, and I'm a single mom, but I have a great job and a roof over my head, and I haven't been worried about those things during the pandemic. But I've been dealing with, and I've been very frank about this, is I've all of a sudden I'm taking anxiety medication. That was new to me over this last year and a half, and the challenges of parenting as a single parent during the pandemic. But I am a white cisgendered woman in an executive position, right? So there's so much more that needs to be talked about. And I think that, some of the misconceptions, I think, are, that there's homogeneity in these conversations versus actually looking at them with more of the complexity that it deserves. And also, I think that, there's still more work to be done to understand what it means to actually be a woman and hold space and try and have these conversations with everything else that is going on. And that in and of itself is something that I think is missing as a part of all of this.
Yeah, for sure. What do you think, Nadine? What are some common misconceptions that you've come across?
Yeah, I brought it up originally, so I'm going to backtrack on it, but it's number one that women are primarily caregivers. And while a lot of women are caregivers, and probably disproportionately so, that is not everyone's identity. So to talk about women who are heads of families maybe, or who have kids in school as a primary issue leaves out a whole lot of other women. And for myself, I live by myself. I live in a very small place. I don't have caregiving responsibilities. The government, I think, was right to focus on families in a lot of ways, but a lot of women who don't have families feel very forgotten by that, quite honestly. And I think, it's such a good point that when we talk only about gender, we don't talk about race and gender. We've had racial reckonings at the same time that we've had a pandemic going on, where, it's been anti-Asian racism, for example, which has had a long history in Canada, has now been revealed. And Asian women, for example, of which I am one, we face a very unique gendered racism. Black women, I'm not a Black woman, but there's a very special kind of violence and misogynoir that they face. Disabled women as well. So I do think that quite often when we're thinking about the pandemic, a lot of people think about people who are most like them. And people so a lot of people will complain that, for example, they've been sitting on Zoom and meetings all day long. And yes, that is actually, I think, physically hard on our bodies. It's hard on us, not being connected to other people. But that has not been everyone's experience during the pandemic. And I think too often we think of people who are most like us and compare our experiences. And I think that universalization is dangerous, and not listening to people who have different experiences and finding out what their actual issues are and not centering them in it. It's the day of reconciliation, and we still have Indigenous women who are killed and face racism in healthcare systems as well. I think it's just really important that we name those things and we daylight those things, and that we actually focus on those experiences really heavily. I know HEU members are very racialized, and that's a whole unique set of circumstances. So when we talk about, for example, there was a lot of applause and banging of pots and pans for healthcare workers, and there were certain types of healthcare workers that were really focused on there, doctors and nurses. And is it because a lot of them are white? Is it because a lot of them are more upper class? There's lots of reasons, I think, why when we picture people who work in healthcare, we picture a certain group of people and other people are forgotten. And I think it has to do with class, race, and gender in large part. So I think just daylighting these things and being comfortable talking about them is really, really important. A lot of people feel very uncomfortable when I bring up race. And we have to feel comfortable naming that. We have to feel comfortable naming white people. We have to feel comfortable talking about our differences as well as what makes us the same.
Absolutely. And thank you for raising so many great different issues. One of which is, led me to remember about one of the important things that happened during the pandemic also was Dr. Mary Ellen Trapel-Lafon releasing the report on anti-Indigenous racism in healthcare. And it's an incredibly powerful report that should and will guide us to addressing those issues in healthcare, both from a worker's point of view, but most importantly from a patient and resident point of view. So that's one really, really important initiative. And if you know about it, please feel free to add to that. But what are some other initiatives that are out there that are, supposed to be addressing the situation? And how well do you think they're working? Genesa, do you want to go first?
Yeah, I mean, I think the challenge, in large part, I think, is that everything that has been brought to light, there's been a lot of announcements and a lot of support provided from government. And I think, I'm incredibly buoyed by the federal government's announcement to not counter what Nadine just said about not everybody's a family or a caregiver, but and completely agree. I mean, in our mental health report that we released at the beginning of 2021, the predominant group that were experiencing the highest rates of mental health challenges were single women living on their own during the pandemic, right? And it is a group of people that I mean, you rarely even hear much more outside of moms managing homeschooling as kind of the epitome of kind of women's experiences during COVID, which is incredibly short-sighted. But the federal announcement around childcare is, I mean, it's approximately 35, 40 years late, but excited to see it happen. It's not going to do anything for a hot minute. It's going to take some time for that to become something that is real and in place. But, I'm encouraged by that. I've seen, there's some work happening at the federal government and provincial governments around wage equity that I also think is something that hopefully is not too far out. And there's definitely been much more attention paid to creating mental health programs that are at the provincial levels rather than kind of assuming that just they can be piecemealed together. But I don't know that I've seen a lot that has been put in practice in play yet that I could say that I'm encouraged by. And that's not to be pessimistic. I just think that it takes some time, obviously, for these things to take root. But I'm interested to see if there's a sustained conversation around the intersectional nature of what it means to kind of navigate the world and what the social sector is going to be able to be equipped to do with that and to kind of see more of the the specifics around it. But there's been kind of limited, other than kind of the Band-Aid solutions that Nadine talked about, right? CERB and all of these kind of wage supplements and rental supplements and, small business loans and those kinds of things. There hasn't been a big enough conversation, I think, around the bigger issues that, as Nadine said, the great revealer. I don't know that I've seen. I was, though, very excited to see that HEU's efforts to bring back in-house several employee groups was successful, because I do believe that is one of many things that I hope come out of these last few months.
Yeah, absolutely. And for those of you watching that may not know what we reference when we talk about bringing these workers back in-house, is in the early 2000s, thousands of healthcare workers, predominantly women, predominantly racialized workers, were arbitrarily fired and contracted out and rehired at half the wages, lost their benefits, lost their pension, And this was done. This was the largest mass layoff of women in Canadian history. So recently, the NDP government has brought back in over 4,000 workers, or is going to be bringing back in 4,000 workers back into the public system, where they will be, having a decent wage again, getting their pensions and the return of their benefits. It's a huge and a very important move for women and racialized workers for that to have happened. I want to put the question to you as well, Nadine, about what sort of other initiatives, because that's one initiative that this government took that righted an injustice and will help with an economic, the economic ability for workers to participate in society. I think this is really important initiative for women and racialized workers. But what do you think are other really good initiatives, and how well do you think they're working?
Oof, oh my gosh, I feel bad that I have to strive. I have to reach. I guess I would say that we have seen pretty big investments in housing. As somebody who works in local government, this is a big thing of what we deal with. It's not within our jurisdiction, but yet we often want to respond because we don't want people sleeping on our streets. We want people housed. So we have seen some investments in housing that have been loosed up. Which I think is good. And I also think that we need more fully public sector housing, truly, we're so far behind on that. I guess it's not really a program, but I think in general, what we've seen is that the government can actually move quicker than they say that they can, right? With CERB, when we saw, even programs for small businesses, et cetera. So we often, governments we must consult, we must do this thing, it takes a long time. And yet when we feel like it's an emergency, we can move quickly and we should move quickly. So I think the lesson learned there is sometimes it is better to just roll out a program and then iterate on it and refine it rather than consult it to death. And then 25 years later, maybe you get some sort of a program like what we've been waiting for childcare. And I think governments at all levels have done this, actually. CERB is but one, but there was also the small business programs that the BC government rolled out. And I think in cities, we did things like tried to make more space for pedestrians, or we closed some roads, some lanes of roads or parking areas of roads to create more space for people who are waiting for a bus, for example. It sounds small, but prioritizing people who take public transit over people who drive cars is actually a huge thing. Big part of the climate crisis. And I just need that we need more acting like we have intersecting crises, because we do. It's not just a pandemic. It's a housing crisis. It's a mental health crisis now. We have a poison drug supply or opioid crisis. We have a housing crisis. We need to act like they are and treat people like they deserve services and dignity, and to really move on it. And then we can refine the details as we go, rather than asking and asking and asking. An example of that is a lot of communities have asked for disaggregated data around the COVID pandemic, and the government's consulting on it. And by the time we get that data, it's going to be too late. We're not going to know who has been impacted at more finer detail level, but we know from jurisdictions that do collect that data. For example, Ontario or down in the States, that racialized people are very impacted. We know in the States, nurses from the Philippines have died at a much a rate. They're overrepresented there. So I think that's an example of when the government tries to consult and they want to build in voices, it slows us down, and it keeps us from doing what we already know needs to be done.
Yeah, for sure. And both of you have raised really, really important initiatives. But both of you sound frustrated that there's just so much work ahead of us. We've got a long way to go. So, what do you think that people can do to get involved, to light a fire under governments all levels, and where can we go for more learning about this and more resources?
I think. My gratitude goes to Nadine for being in local government. I have to say that being in government right now, or running for government, it is a pretty thankless exercise in a lot of ways. It's a tough time to be in the public eye, but I'm grateful for folks who are doing that, and we. I think there's probably never been a greater time for the individual to have a voice than there has been right now. I think, we've seen the how social networks play into it. We see how news cycles are moving very quickly. We see how the collective can change minds. And Nadine, I'm with you. One of the things that I've in my conversations, more especially with the federal and provincial governments as of late, is just reminding them that the speed for which they've made decisions in the last 18 months should not be abnormal. It should actually be how we do things moving forward. I mean, we've changed laws in mere hours and days in the time of this pandemic in order to be able to keep our citizens safe, or I wouldn't even just say citizens, because I actually find that to be a very exclusionary term. But we have a responsibility, I think, as individuals to hold our government to account, to continue to push in those ways. I think it's also been an interesting time where we have had to pull together without being able to be in community in typical ways, which has really felt hard. I know, at least for a lot of folks that have been in grassroots movements, and how do you do that when it's so much harder to get together? But I think we should continue to encourage ourselves to find ways to do that, and to build collective powers together, and to expect more of ourselves, right? I think that Nadine laid out a lot of incredible policy pieces, and that requires us to actually care as much about our neighbor as it does about ourselves as we make decisions moving forward. And I know there's lots of opportunities for us to continue to support the nonprofit sector. There's lots of opportunities to find unique ways to volunteer, and also to elevate the plights and challenges of others in whatever your social or professional circles might be. And everybody is in a different, different set of circumstances. But that, I think, has been one of the things that at the beginning of the pandemic, I think was hard for a lot of folks, is we lost our ability to actually feel like we were helping people, and that felt very isolating. And I'd encourage us to find as many ways as we can to come back to that. And because there are plenty of organizations out there doing very important life-saving work that could use all of us to connect with them, and to continue to kind of find ways to give of your time, to give of your voice, to give of any resources that you might have as well.
Absolutely. So Nadine, I mean, you're up to your elbows all the time in this. What can other people do to get involved? Maybe not to the extent that you are, but certainly I'm sure this is your opportunity to ask people to jump on in. And where can we get more learning and resources?
Yeah, I think one of the important things to realize is sometimes when we get hot on an issue, we're like, why am I the only one who sees this? I've got to do something. And in reality, generally, there's a lot of people actually who have been working on it. Pharmacare is but one example where a lot of people come to me like, we need a national pharmacare program. Like, oh yeah. And people have been working on it for a long time. So join up with them, right? Learn from them. It's not to say that you can't start your own thing, but it's really good to join with other people who are active on the same thing, who are saying the same problem and want to work towards a solution. So trying to find those like-minded people. I think that's a big one. I also have created during this funny time an organization called Feminist Campaign School to try and get more underrepresented people. So that can mean different things in different communities. Elected to local government, we know that local municipal government, so mayors, city councils, school boards, are the least representative form of local government. And what that means is it is a lot of white men who serve at that role, despite the fact that that's not who makes up our communities. Of course, there are white men in our communities, but they're not the majority. But they are by far the majority of people who serve at local government. And it's really hard. I recognize that for a lot of folks, it is scary and it's difficult. But Feminist Campaign School is there to sort of teach you how to run for office if you want to, how to put your name forward. And we also have a stream for campaigners who might want to support better people to get involved. Because I think that's the big thing too, is that local government is not for everyone. Not everyone wants to read these agenda packages and talk about parking ordinances. Like I get that. But we do need better people elected at all levels of government. That's from our unions, our student unions, local government, federal, all of that. So it's a chance to, if you know somebody good who should run, it's a chance for you to level up your skills and support them. And I think a lot about campaigns. So not just political campaigns, but issue-based campaigns. And there's a lot of tactics in there that we talk about as well, on how to run effective campaigns and decide who's a decision maker and how do you target them. So I think there's that. I learn, like, this is my thing that I do with my time, is I try and spend a lot of my time learning, and I do it in a lot of different places. Like, there's some great podcasts. So if you're taking transit, download a podcast from somebody whose voice you don't often get to hear. I'm an able-bodied person, so I try and spend a lot of time learning about disability justice. Or on Twitter, even, again, not the most friendly place, but a lot of the people on my Twitter feed are Indigenous, queer, Indigenous, trans, and Two-Spirit people, a lot of Black women, and I spend a lot of time just listening to what they have to say. And you can curate feeds on social media that actually teach you perspectives that you don't often hear. Of course, there's books, there's online articles, all those great things. I actually, on my website, NadineNakagawa.ca, I actually have a list of podcasts, articles, books that I'm reading, just so that people can learn along with me, because I think learning is such a beautiful gift. And if we have time and energy to do it, it's something that I really feel is like a personal responsibility of mine. So yeah, lots of ways to get involved. And if people have campaigns, ideas that they want to share with me, I'm always happy to talk them through with you and help refine them or amplify them or do whatever that you need, but just connect you with people, but just really try and help you achieve your goals. So really happy to support if anyone wants to reach out.
Thanks so much for raising that, Nadine. I was a little bit worried that you weren't going to talk about your campaign school. It is such an awesome initiative. I am so excited about the work that you do and the people that come out of that. It's fantastic. We'll make sure that we get that put into look at, you already did it. Nadine Feminist Campaign School is in the chat, so please do check that out. Whether you're an aspiring campaigner or candidate, that's definitely the place to go to. Because it is important. And I just want to also shout out to my friend Rhonda Bruce saying in the chat about how important it is to have female representation at all levels. So getting involved is really important. And also, I'm going to jump ahead as well. And Nadine's, your Twitter account is so fun to watch. I always learn so much from your Twitter. Whether it's, feminists or Indigenous issues or, even I learned about a consent agenda from your Twitter feed. It's a great place to learn for sure. So we'll make sure that we put that in down as a resource for learning more. Okay, so here's my favorite question. It's always a great way to sort of wrap it up because we're getting close to the end. I want to know, to both of you, what gives you hope? Genesa?
Yeah, first of all, high five to the consent agenda. Big fan, big fan of the consent agenda. I just want to add to something that Nadine just said too. I've always been a big believer that the sooner we can get to a point where the majority of positions in the world are held by women of color, we could probably actually resolve most of our concerns and challenges that we have globally. And so, as a white woman, and for those that are potentially watching this who are like me, I'm in the checkbox of I'm just one checkbox away from being a white male. When you look at I'm able-bodied, I'm cisgendered, I'm well employed, and I view my job to get out of the way and amplify and to do my best to try and help elevate the voices of people who need to be heard in policy development and in these larger conversations. So I would encourage folks to do exactly what Nadine said. I think exposure and self-learning and building community that doesn't look like you, sound like you, pray like you, or have sex like you is probably a wise decision for all of us. And I think for me, what gives me hope, it sounds simplistic, but honestly, my son, I think if I watch younger people today and how they view the world and what they expect of us. It's like what we're trying to do is fix problems to build a world that most young people would have actually probably just built differently. And I think every time that I kind of get lost in the mix, I think there's lots of things to prevent yourself from losing hope. I think reducing the doom scrolling we all do on social media. I think making sure we find ourselves in conversations with people who can see the possibility and the opportunity in the world is great. But I'm hopeful. I'm hopeful that we're seeing our communities better represented in government. I'm hopeful that our kids see everything that we're trying to strip down from my generation and older as, kind of being on the outside is actually just being what's normal and what should be accepted and what we should be elevating and appreciating amongst ourselves. And I'm hopeful that maybe we've seen enough in this last year and a half that we can't turn our eye away from what's happened for far too many. And, we've been pretty fortunate here in Canada when it comes to how we've been able to navigate our way through this pandemic. And we've talked a lot about our own issues and policies, but I'm also hopeful that maybe we've opened our eyes to the bigger global conversations that we also should be thinking about in how we support other countries, other governing bodies that need our support in ensuring that these pandemics, because this, as Nadine said, this isn't the only one that's happening, right? I worked in the downtown east side for over 10 years, and the opioid pandemic. We've got a climate crisis. We've got a gender-based violence pandemic globally that we can't turn our eyes to. And so I'm hopeful that we're talking about this and that we'll continue to push for change. And I'm hopeful that we'll get frustrated at the pace for which it's happened in the past, and that we won't think that that's okay moving forward. I'm just grateful. I think even these conversations for me are hope-giving and life-giving, and appreciate the opportunity to even just participate in them. So thank you.
Well, we're so happy that you are here. Nadine, what gives you hope?
Well, it would have been nice to actually be able to see the faces of the people here, because that usually gives me hope, just seeing people who care, and who are passionate and who believe that a better world is possible. I think also, the awareness that has happened over the past year and a half. It used to be that if we talked about issues relating to Indigenous people, Black people, people of color, it was not well received in general. As somebody who talks about these things a lot, it was not well received. And now we have a world in which I don't know that we can say that we don't know. Before I did think it was a lot of willful ignorance, but now I think it's pretty impossible to say that you don't know that we have racist issues in our country, for example. I think that mutual aid campaigns give me a lot of hope. The way that people have tried to rally, even in the hardest of times, and it's often people who are themselves marginalized and struggling, who rally around other folks. It's really without needing structure or organization or government. They just do it because it's what needs to be done. And I think that the idea of centering joy and pleasure in our movements as well. I think for too long, there was this idea that we needed to be robots, that we needed to be martyrs for the cause. Whether you work in nonprofit or healthcare, whether you're an elected official, we had to be martyrs. We had to give everything and sort of bleed out there on the streets for what we believed in. And I think the idea that we should actually laugh and dance and take pleasure, and have delight even in hard work. Centering that is a conversation that I'm hearing continuously now. And I think that gives me a lot of hope, that it's recognizing people's humanity, that we are humans. We're not just workers. We're not just employees. We're not just, people within a capitalist context. So I think that gives me a lot of hope. Oh, and moss and mushrooms. Oh, learning about mushrooms these days gives me lots of hope.
That was really moving until you got to the mushroom part. You'll have to take me mushroom hunting then one day, just so I can understand the joy of mushrooms. That's fantastic. I'm just going to look to our the tech people to see if there's any questions. And while we're doing that, just making sure that folks that are out there in the audience, If you have any questions, this is your last, chance to do it, or I'm just gonna go ahead and ask. And one thing I do think, Genesa, that I think it's worthwhile talking a little bit more about the work of the BC Women's Health Foundation, and around some of the reports that has been released around unmasking the gender inequality. Here's some space for you. I would love to hear more.
Sure. Yeah, thank you. So BC Women's Health Foundation is a pan-provincial women's health equity organization. We support BC Women's Hospital, of course, in Vancouver, but we also support women's health research and innovation, but also education, awareness, and advocacy at the intersections that women experience when it comes to healthcare. And part of that, especially these last few months, has been looking at new immigrant women, refugee women, people with precarious immigration status, healthcare workers especially, and also looking at Indigenous women. And we released a report called In Her Circle, actually, that you can find on unmaskinggenderinequity.ca as an additional kind of sub-site to our website, where we've talked about the socioeconomic impacts of the pandemic, the caregiving impacts, the gender-based violence impacts, the mental health impacts. And we did do an In Her Circle report that we actually provided the resourcing to Reciprocal Consulting to do a multi-pronged consultation process with Indigenous women and Two-Spirited folks across the province, asking for their insights as to, how the pandemic has continued to compound what have already been just insurmountable challenges in getting quality health care when, where, and how they need it across the province, and also what it means to be an Indigenous person just navigating the healthcare system. And there were 20 recommendations that were very complex that came out of that report that are going to require, intergovernmental responses and interagency responses and a whole slew of things that really are going to take a great deal of time and thought and effort, I think, to respond to. But we're committed to staying the course and ideally facilitating and convening and supporting, and not actually raising our own perspectives and voice, and especially in those spaces, because I don't think it's our place to do so. But we really have seen this pandemic really bring to light just how inequitable women's access is to healthcare, and also just how gendered the healthcare workforce is, and what that actually means when it comes to kind of what it means to be a woman working in healthcare. And over 80% of the healthcare workers in the province are women, and over 20% of women who work in the province work in healthcare. And as Nadine mentioned, and Barb, you and I, we've talked about this a lot, predominantly the membership of HEU are racialized women. They're invisible healthcare workers who've really been experiencing so many of the kind of disparate pressures of this pandemic in their personal lives. And Nadine, you mentioned this a little earlier too, but one of the we've been in the process of finalizing a risk and resilience in the health workforce from a gendered perspective report in partnership with HEU and with researchers out of SFU and Johns Hopkins, and the Gates Foundation was also a partner on some of this research. And ultimately, I mean, there's just so much richness in the narrative, and that's the piece, Barb knows how I'm all about story. Like for me, it's marrying story with science. That's where real change comes from. That's where policy change comes from. That's where, political movements come from. And we want to be able to give voice to the invisible healthcare worker and what it has meant to be navigating these times. And then when you add things, we've seen a significant increase in racism towards Asian healthcare workers that, hasn't, in my mind, gotten near as much attention. What it has meant to, just be continually feeling like you're exposing your family to so many of these challenges. And a year ago we were banging pots and pans, and now we're outside hospitals with picket signs. It feels like we've lost something in these last few months around really understanding what it has meant to hold up our health systems and who is holding up our health system. And so as our part of our foundation's work, we really think it's important to have that conversation, because I think it can be said, and this is, not to bring it down around the hope conversation we just had, but I think it can be said that, as we navigate all of these various pandemics and epidemics all at the same time, they actually do intersect with the healthcare system almost in every regard, right? If you think about gender-based violence, that interacts with the healthcare system. You think about the opioid crisis, it interacts with the healthcare system. You think about climate and how, Black, brown, and poor people are going to be hit first and worst by climate change in this, on this planet. That's going to interact with our healthcare system. If we don't figure out how to value everyone who works within healthcare, pay them what they're worth, give them the supports that they need, that system is going to implode, and we're going to have a whole other slew of challenges on our hands. And also, just at bare minimum, it's the morality. It's the right thing to do. It's not just because it holds our health system together. So, I'm really grateful to be centered in being able to kind of pull some of these pieces together, so we as a foundation can help HEU and others bring those conversations to bear, tell stories that don't allow people to look away and think, oh, that doesn't concern me, or it's not something I need to worry about, so that we can make sure that this pandemic doesn't leave us in a position where we can't continue to be the kind of communities of support that are necessary.
Yeah, absolutely. And that's exactly why we're doing this work together, Genesa. And I'm really, really excited about where this data, this research, and most importantly, those stories are going to take us. Mm-hmm. All right. Well, I hate to do this, but we're going to have to leave it at that for today. I want to thank my friends so much, Genesa and Nadine. Thank you for this really engaging and important conversation. I also, again, want to thank the Women's Committee at HEU and all of the activists that are supporting women during this very challenging time. And of course, thanks to you, our members and the participants, for joining us today. We would really love to hear how you feel that this session went for you. So please fill out the feedback form, which is going to be put into the chat for you. As well, we will be emailing it out to all of our registered participants. So our next session will be the last one in this series, and it's building on what we've been talking about all along, but particularly tonight. Our next session is going to be same time, same place, Wednesday, October 6th. But this time we're going to be talking about addictions from a human rights perspective, and we will be talking with Heather McCain and Laura Track. So everyone, thank you again for coming out and joining us. Thank you to our amazing speakers. And I hope you all have a great evening, and we'll see you next week. Have a good night.